Hi. The question has been posed to me that what key principles should MFTs use to guide their approach to psychopharmacology with clients? The first thing that we need to do is we need to take into account the needs of the patient. What are they suffering from and what are the symptoms? It's important that we know each one of our clients so that we are able to better serve them and be able to direct them in the way that they need to go. Do they need medication or do they not? Having a good idea what the problem is as we interview family members and those around them and the patient themselves. I need to have an understanding of, what does their environment look like, and how, if I implement a referral to a psychiatrist, how is that going to help the family and the individual? How the family interacts with each other plays a great part in how well an individual will do, and that's why it's important. Does this person have the means to obtain the medication? What kind of resources can I help promote to get some medication? And or does this person even need medication, and will it help? I need to be on top of what the current research on medications are and how effective it is to treat certain disabilities or diagnoses. It's important that I understand this because some medications don't do well with certain diagnoses, and some diagnoses don't do well with just therapy talk or talk therapy, apologize. And nor does, and some of them might need to have both of them. That might need medication and talk therapy, and some diagnoses won't necessarily do well with having a medication on board. And so that's something that I need to be aware of, and what diagnoses those are, and if I should be referring that person out. The other important aspect of this is the approach that I need to take is that to be able to modify the plan as we go. Sometimes patients are in therapy, and as we go, they are doing well on with no medication, and we don't have to implement a medication plan. But at some point in time, there might need to be that. So being able to modify their plan as needed is important too. And vice versa, the situation might be that they are on medication and the medication is or is not working, and that might need to be modified. And so it's important that we have an open plan that we can be able to modify it as needed. It's important that we learn that some disorders, as I suggested earlier, that they do better with medication, and some of them don't do well with medication. And so we have to have an understanding of that, and when talk therapy and medication are appropriate for an individual. The next question that is posed is, how could MFTs take a proactive stance with respect to the limitations and benefits of drug therapy? I'm going to, I would need to be able to understand what medications work with what, and be able to refer them to a psychiatrist that can evaluate them. We need to be able to take a proactive stance when a person comes into our office and we see that there is a need for medications, that we offer them some resources to be able to get some medication, and be able to refer them to certain places. Some, maybe some psychiatrists will take certain insurances or not, but it's important that we have an understanding of that in respect. We need to work together with other clinicians as we to best offer our treatment plans, and be able to help the individual as we work together. There might be some, if we do refer them to a psychiatrist, let's say, and that psychiatrist does prescribe medication, then we can be on board with one another. It's important that we understand what the different individual medications and their side effects have on people, because some of them have side effects that are possibly suicidal, and so, or suicidal thoughts, and so we need to be in conjunction with the different therapy treatments, and we need to be able to be proactive with that, and the benefit and the limitations that has on a person. And we should be able to see that when they come in and say, hey, I've been feeling like I just want to kill myself, and we know that there's a medication therapy that they're taking that could potentially have that side effect, then we can then again work in conjunction with the other clinicians to be able to help that individual with that situation. We need to develop a plan that if it includes medication, that we do understand what those side effects can be, and we need to have a clear understanding of how the medication may or may not help an individual, and have family members take note if the medication is having a positive effect and on them, or a negative effect. So it's important that we, sorry about that, it's important that we have an understanding of what's the medication doing for the person, and is it beneficial, and is it not beneficial, and so, and what are the possibilities of this person maybe having to change their medication, or should they be on a medication at all. The last thing I have is to say is to also have in place a plan, in the plan, that at some point that maybe they can discontinue this medication if it's possible. I think that's important too. Are there limitations to that, if they are benefits to them possibly getting off their medication? Thank you so much. I appreciate that.